into this with a few minutes left. Um, Basically, if you want to be a cool orthopedic sports therapist, you just want to know a little bit about how to screen for the pelvic floor and how to refer out. And also, just to reiterate what Irene and Melanie have already um, presented, that even if you don't um, think of yourself as a pelvic floor specialist, you can have a profound impact for your patients' lives by doing a complete assessment on their spine, their hips, their breathing, their abdominal fascia, their total posture, their feet. So even if those listening have no intention of becoming a pelvic floor specialist, have confidence in the fact that if you know a few questions to ask, go through your process in evaluating and treating some of these major components that can um, have a profound impact on pelvic function and pain, even if you never directly touch the pelvic floor. So hopefully we can just add more confidence to the group there. Okay, and I believe that pelvic function, from my own experience as a sufferer, pelvic function can be debilitating, or pelvic dysfunction can be debilitating. But if you learn how to overcome that or help a patient understand their pelvic function, it can be a profound cornerstone of health and performance and athletic performance as well. So just touching on, I think what's already been said, maybe in the past, pelvic therapists, we just got in there and worked the pelvic floor and told the person to see somebody else for the spine and their hips. And perhaps in the past, orthopedic specialists have been too afraid to follow their instincts, from tissues that might have been dysfunctional into the pelvic floor. So key drivers of pelvic dysfunction, uh, we've already touched on these. Hip, if there's hip weakness or hip tightness, great place to work. The trunk muscles and abdominal fascia, and chicken or the egg, if there's weakness in the core or tightness in that abdominal fascia, that can be, or even let's say presence or a vulnerability to hernias, great place to work with people. Definitely assessing the breathing quality, and just to touch on that, are they capable breathers? Are they not breathing completely into one or several segments? And if I can just share something that I'm tending to do a lot more of with my patients when it comes to breathing, is to have them focus on breathing into their back. I'm just having better results with that currently. And laying over the overlay of the Winback and being able to treat these areas, even just a few minutes. So there's a lot of regions here to address. But because we have the Winback in our clinics, with a few minutes of treatment, we can make a significant impact in the quality of these tissues. And then we go back and assess that driver. And then we also ask them about, hey, have your pelvic symptoms happened to change? Or do we see your hip range of motion improve? Is your breathing improving? Oh, and if we were to do an EMG on the pelvic floor, is the pelvic floor function going the way that we want, for those of us that are testing for those things? Yeah, and so just reiterating this point here, here's Frederic working on Dr. Tucker in San Diego. Okay, this is just an example of working on the hip rotation. Dr. Tucker's getting something good happening there. And Frederic is here, he's using that RET on Dr. Tucker, helping to open up some of that hip rotation. Okay. Yeah, and so it was mentioned, Melanie, you had a background with NIOPS. Okay, those of us here on the call that love looking at the thoracic spine, that is such a valuable place to go to help pelvic dysfunction. So assess, rotation and extension and side bending, and make sure that if there is a limitation there, try a few minutes of treatment on the left and right of the spine. And looking externally, does that help their balance? Does that help their hip range of motion? And if you're able to assess for it directly, or even ask the patient, does it feel like you're more aware of your pelvic floor now after working on one of these disparate areas? So then this heading here is, how does Winback help the pelvic therapist be a more complete therapist? It definitely allows us to make a greater impact with less time, and also have a gentler, let's say more positive impact directly on the pelvic floor if that's where we're working. But it also frees us up to be able to treat the feet. Let's do a few minutes of treatment on the feet. Let's do a few minutes of treatment on the SI, the thoracic spine, the hips, the abdominal fascia, and so it just helps us be able to hit a few key areas in addition to just needing to spend 30 minutes on the pelvic floor, which is what I felt like I needed to do before bringing Winback into my practice. So again, I think also that was stated before, I like to warm up here. I'm working yesterday on a patient with a hernia repair. And so we're working, pretty superficially to warm up the tissue and break up some of those surgical adhesions there. And just some other notes is that these suite of devices that Dr. DeFabio talks about gives us a range of options to treat directly on sensitive tissues, if that's where we're going, and it allows us to be very specific on treatment depth. Again, later on in that treatment, using CET to get a little deeper into spermatic cord. And there's, on the machine itself, there's also these different options. So if you're trying to treat a fairly small area and you don't want pure thermal effect, you want a few different layers without even having to change your device, there's many settings on the machine to vary the waveform while you're working. And that's been really great to learn more about that. And I've got a lot more questions for my colleagues that are more experienced at that. Yeah, I would just reiterate here, my patients tell me that it's more comfortable than standard care. They like it more than standard care. I'm just going to play the audio of what my patient told me here yesterday.
Can't hear it.
No audio, Grant.
Okay, so glowing recommendations.
Oh, it's on your earpods, I think.
Oh, you guys didn't hear that? Okay, my patient loves it. That's all basically all he wanted to say. And here's me working on Dr. Tucker. We're getting right into his low abdominal fascia. And just my point here is saying that, it allows me to comfortably, with a relatively short amount of time, make a profound impact on a tissue that could significantly impact the person's pelvic dysfunction. And I would say it's been, Winback has been a cornerstone of my practice and allowing me to learn more, get good results for my patients, and be a resource for my colleagues in my area that have difficult cases. Simply by having this device since November, I get the chance